Health officials call for renewed progress to combat antibiotic resistance. Minnesotans can keep antibiotics effective by using them properly and only when they're necessary. Mirroring a trend seen nationally, Minnesota's progress towards reducing antibiotic resistance lost ground in its recent years. But when the Minnesota Department of Health is aiming to work with healthcare partners to renew and accelerate the push to preserve antibiotic effectiveness. Following years of reductions in antibiotic-resistant infections, hospital-related resistant infections and death increased at least 15% nationally during 2020, the first year of the COVID-19 pandemic, according to a new report from the Centers of Disease Control and Prevention. From an article titled COVID-19 U.S. Impact on Antimicrobial Resistance, the progress on improving the ways in which antibiotics are used has also taken a step back during the pandemic, according to this report. Minnesota Commissioner of Health Jan Malcolm has said that the past few years presented many challenges. We know that our healthcare system has been strained, and this has contributed to the growth of antibiotic resistance. However, preventing antibiotic resistance is extremely important. We must regain and accelerate the progress that we had been making before the pandemic hit. People's lives may depend on this. Antibiotic resistance happens when bacteria, germs that cause many serious infections in people, become able to resist the medications designed to kill them or slow the growth. Bacteria that become resistant to antibiotic medications can lead to much more severe infection and even death that would not otherwise occur. The more that antibiotics are used inappropriately or when they are not needed, the more likely the bacteria are to develop resistance. The problem of antibiotic resistance is one with both local and global impact, as even common infections are becoming harder to treat, health officials say. In Minnesota, one group of extremely drug-resistant germs, the name of this germ is carbamenapase-producing gram-negative bacteria, was detected in an average of 30 patients each year from 2009 to 2018. During 2019 to 2021, detections decreased by 90% to an average of 57 patients per year. Of great concern, through October of 2022, these hard-to-treat germs have already been detected in 68 patients, making this a record year for this dangerous threat. In the decade prior to the pandemic, Minnesota, much like the U.S., made progress in reducing rates of infection caused by antibiotic-resistant germs. This was achieved by increased infection prevention and control efforts in healthcare facilities to prevent the spread of resistant germs and improvements in the way that antibiotics were used. Much of the progress and improvement of antibiotic use has been driven by education of healthcare providers, patients, and families. In response to recent setbacks, MDH will refocus educational efforts and expand its work with partners to slow the development and spread of antibiotic resistance. It will use its surveillance data to guide and measure progress on prevention-focused initiatives in hospitals and nursing homes to detect and prevent resistant bacteria. Also, recommitment to progress will be the theme for the state's Antibiotic Stewardship Conference in the spring of 2023. President and Chief Executive Officer of Minnesota Hospitals Association, Raul Corrain, doctor, says antibiotic stewardship and infection prevention leaders are an integral part of care team on the front lines as we combat resistance infections and spread against resistant germs. As we highlighted throughout the pandemic, we can make a bigger impact on critical problems like antibiotic resistance by working together across industries and between public and private sectors.